health. That's simple as that. And then we associate it with bits and, you know, different things.
Jadoo karke khala.
Exactly. So I think the most common, the top of the list thing we're talking about is vitamin D deficiency, especially if we're talking about the weather. Because we like to stay indoors, we don't want to go out, we don't want to get tan. So these are different reasons. And the other reason is that we're not taking enough diet. So these are the two main sources of vitamin D, either by diet or by sunlight.
Okay, so how do we get to know that we've got vitamin D deficiency in our body?
You get all sorts of symptoms, to be honest. Like patients are coming to me, they're complaining of joint pains, muscle pains, hair loss, dull skin, irritable mood, depression sometimes. And sometimes these patients are thoroughly investigated. They spend thousands of rupees for investigations, like for arthritis, for other things. But the bottom cause is vitamin D deficiency. A simple test, a simple solution.
And they say that vitamin alone cannot work. So vitamin needs to be married with calcium. You know, is that true?
Yeah, they need to be married, yes.
Okay. So what do we need to take first? Is it calcium or is it vitamin?
Both, because vitamin D helps in absorption of calcium.
Okay.
So if you're taking a supplement, because sometimes people they come to me and they say, oh, we are taking vitamin D or we are taking calcium, but they're not taking it together. So it's important if you're taking vitamin D and calcium together, that will help the absorption of calcium in your body.
All right. Okay. And then one of the most common problems which I know is degeneration as well, you know, because I even got my backbone operated. I'm sorry I have to say that, but it's for all of those people out there. And I know that, you know, over here in Pakistan especially, ladies and gentlemen, people who are tall, they usually go through this problem as well, where they have these backaches and pains or disc prolapses for a while too as well. Is that because of the deficiency too as well?
Again, I would say exactly. I mean, the root cause is again the deficiencies of different calcium and vitamin D. Again, our lifestyle, our posture, the sitting sort of jobs we are doing. But important thing is that we are looking at any red flag symptoms. So if you're talking about a back pain, there's a mechanical back pain and inflammatory back pain. Mechanical back pain is something you've lifted something heavy or any posture or pillow, things like that, and you're getting pain. It's going to get away in a couple of days with rest and some painkillers. So that's a simple thing. We need to keep an eye on any back pain that is going on for more than months, like 6 months. It's really worse in the morning.
Numbness in the leg.
Exactly. Going on for a couple of months, not going away with simple remedies and painkillers.
New Brolfort.
Yeah, you need to see the doctor. There could be different reasons for it. Again, I would say don't go and get your blood test done. Don't go and get your x-ray done. First of all, see a doctor. And see what the bottom cause of your problem is.
Well, that's great. So, ladies and gentlemen, Dr. Saudi over here is actually recommended that first things first, what we need to do is get the diagnosis right. Once the diagnosis is there, then only then you should actually proceed with all of that testing too as well. But very quickly, what solutions do we have for these shoulder pains? A lot of other people in my gym even have these shoulder pains as well, where, you know, it affects the movability, you know, we cannot just kind of extend our hands, you know, we cannot go lower to a certain point. What are the solutions for this?
I mean, it could be something very normal with the gym, like you get gym pains. But if it's going on for a couple of weeks or months, it could be because of the inflammation in the tendons. Normally you call it adhesive capsulitis or frozen shoulder in simple terms. It's just inflammation of the ligaments and the muscles inside the shoulder. It's a complex joint. And all you need to do is keep the inflammation to the minimum. Make sure that you are warming up before you're doing any physical exercise. And other things like icing, elevation, giving it a rest when you think it's getting worse. So these are simple things. If they're not working, however, then you need to get it checked, get a proper x-ray or MRI and see what's happening inside the joint.
All right. Well, that's great. And God forbid, ladies and gentlemen, if the MRI says that, you know, there's a nerve trap or something of other sort, I think that you really need to get it treated or get a surgery done too as well. And it is important. People over here do delay surgeries. I've delayed my backbone surgery for like 6 years, and now I know how it used to be. And, you know, when there are solutions and you can just be all right within a week's time or 10 days' time, why not opt for that? And the sole reason why I couldn't actually get my surgery done was because of the fact that people over here kept on saying, oh, you know, you won't be able to walk and things like that. So the medicine has progressed quite a lot. Please trust that. And now moving on towards arthritis, one of the very common problems over here in Pakistan. Quite a lot of elderly people are going through that as well. And now I've seen that, you know, quite a lot of younger people have got this similar problem. What are the causes?
Lots of younger people, I would say. Lots of younger people. And I think if I just have to explain the arthritis. There are two broad categories for arthritis.
Right.
So one is called osteoarthritis. That's the normal degeneration one, normally affecting the lower body joints like hip or knee, mostly associated with obesity and our lifestyle. So that's something that's just wear and tear in the joints. What I like to emphasize as a rheumatologist is the rheumatoid arthritis, that's also called as Gantia in Pakistan. That is something inflammation in Gantia, yeah.
Is it in Urdu?
It's in Urdu, it's called Gantia.
Okay.
So it's inflammation in your joint, sozish, inflammation in your joint. And that is something we need to pick up early so that we can start the treatment and we can prevent the patients from any disability or any further problems. And this is the part which is affecting young people, especially young females. They're coming to me with multiple joint pain, swelling, redness, fever, lethargic. These are the main 4 or 5 symptoms of this problem. And again, if it's going on for a couple of months, please do see a rheumatologist and get it evaluated.
Okay, well, that's great that you've said it. Ladies and gentlemen, all the symptoms are out there as well. But just one simple thing, and I know that I do not want people to be hopeless in this case, but is arthritis treatable or curable?
My answer is very honest. It's not curable. That means I cannot give you a medicine and suggest you for 6 months and I'll say, oh, it's going to go away in 6 months. It's not something like a flu or virus or infection. The arthritis, the rheumatoid arthritis, it's coming from your own body. It's an autoimmune process when your own body attacks your joint instead of attacking the bacteria and viruses.
But why?
I would say it's just a genetic, environmental, and different other triggers.
Our forefathers didn't actually had a good diet.
Exactly. I think it's our diet basically, diet, lifestyle, different deficiencies. So our immune system is weak. So it's difficult to find attack the exact bacteria or viruses. So instead of that, the immune system is attacking your own joints and your own tissues and causing inflammation in them.
So I've got a very great understanding of that. So what you're trying to say is that people with lesser strength within their immune systems are actually going to have arthritis in the later years of their age.
I would say that.
Well, that's how it is, ladies and gentlemen. But then there are solutions, as she said, that if the diet's great, if you're looking out of your calciums, vitamins, I think that you can probably delay that and you can manage to be away from that particular disease because it is very painful. You really need to have some solutions for that too as well. But other than that, what are the home remedies? I mean, because people over here, we are very fond of doing home remedies. Kamar mein chuk pad gayi hai, hot water bottle. And then other than that, I've seen Google quite a lot of times, and Google says that ice packs needs to be there. So putting an ice pack over wherever you feel pain or a hot water bottle, which one's better?
I would not give any points to any remedies or totke. I would again emphasize here through your channel that if you're having any problems, any medical illness, any pains or aches or swellings, please first see a doctor. Get their expert opinion.
Don't do it yourself.
Don't do it yourself. You don't know what's happening. Instead of getting any benefit, you might get any side effect from those remedies or painkillers or malshe and takore and all that. Please don't do that. Your body is a gift from Allah Ta'ala. Please take care of your body. Don't experiment with it. This is my message.
My body's a temple. Okay, but other than that, very quickly, I've seen a lot of people with their right foot thumb, swollen, and they are not able to walk. And whenever I've asked them, they're like, oh yeah, my uric acid's on an increase, so and they're mutton lovers, and there's a lot of things which they eat which they shouldn't actually. So what do you think people really need to do with gout and uric acid problems?
Exactly, gout is used to be called as the king's disease because in ancient times the kings were getting it because of their lavish eating habits. But now I'm seeing it very frequently in our population. Normally, like you said, it's presenting with the pain and swelling in the joint, especially starts with the big toe. Uric acid is a byproduct of protein. So if you're taking a lot of protein in your body, like meats and pulses and sugary drinks or artificial drinks, so these are causing increased levels of purines in your body, and these purines are going to convert it into uric acid and then deposit into your joints. And uric acid is very actually painful because they're needle-like crystals. So if you're having these symptoms, your uric acid level is high, you're getting joint pains, please do see a rheumatologist and get it checked. However, in Pakistan, there is also another misconception that everybody with a joint pain, oh, your uric acid is high, you should get it checked, you should take the tablet for uric acid. Please don't do that. Get it checked by a specialist doctor.
Well, that's great. Thank you very much, Dr. Sadia, for being with us. It was very much on point, and I love the conversation because I think that we've given you quite a lot of solutions.